talk
This
about
conference will now be recorded.
yeah, transdermal drug delivery system. Okay. So, people have heard of transdermal drug delivery? Have heard? Hello? Hello? Hello?
Yes, sir.
Hello?
Yes, sir. Please.
Yes, sir.
I'm audible or that's a problem? Yeah.
No, no,
Yes,
you
sir.
are
Yes, sir.
sir.
You're audible.
Yes, please reciprocate. People have heard of transdermal drug delivery system?
Yes,
There is
sir.
a
Those are the
disturbance.
patches.
Okay. Yeah, good. Good, ma. Yeah, tell. Ah, okay.
So the
Ah.
transdermal patches are placed on the skin, and through the skin, absorption of the drug is happening, sir.
Yeah, yeah. These are nothing but, as per the definition, yeah, as per the definition goes, as you can see here, transdermal drug delivery involves transport of therapeutic dose of medication through intact skin. That's very important. Okay. It is not like when you are applying something on the wound. That cannot be called as transdermal. Okay. So it's something like what you're applying on an intact skin so that the drug is delivered into systemic circulation where the action has to be shown at some other site of the body. Is it clear? Are you able to understand? Yes? Hello? Hello? People are able to hear me?
Yes, sir.
Aditi, please respond. Okay, so transdermal drug delivery involves transport of therapeutic dose of medication through intact skin into systemic circulation. That's a basic definition. So now, transdermal drug delivery was only an imagination earlier. Okay, but because we were aware only about what you can call it as a conventional drug delivery system, you can't even say it's a conventional, it's conventional dosage form, such as a semi-solid dosage form, okay, which is meant for what you can call it as topical action, something like an ointment or what you can call it as a gel. Okay, so it was highly imaginary that you can apply something on the skin so that the drug is delivered to a distant site in the body. So something I'm just telling you, for example, you have a CNS drug, you have a painkiller, for example, you apply it in the form of a patch and the pain gets reduced. Okay, that's one example what I can cite. Fentanyl patch is a classical example. Anyhow, I've got some of the examples, classical examples for you people, for you to go through. So that is how the transdermal drug delivery is found to be later on an attractive option for conventional dosage forms such as tablet, capsules, injections, or even, for example, topical gels or ointments. And that is about, so you can see there, the drug delivery market, this is what transdermal drug delivery market, it kept on increasing over the last 1 decade or more. Okay, and now many products are made into the Indian market also, as you can see. Yes, so this is what there's a pictorial representation which depicts the difference between the topical and transdermal system, whereas you can see here the topical is the one where you see only a localized delivery. All of you are able to hear me? Hello?
Yes, sir.
Yes.
Yes, sir.
Yeah. Yeah, thanks for the response. Okay, topical drug delivery, as you can see here, something like an ointment or a gel. As I told you, it's meant basically for a localized action. Okay, wherein the target site is very close to the site of application, where you see the pharmacological response. Okay, that is one mode. And what is transdermal? So this is transdermal. This is a skin. For example, the barrier across which the drug has to cross, this is a skin, for example. Okay, this is your transdermal patch from which the drug has to get released initially. Okay, you're able to see my cursor when I point out? Yes? Yes or no? Hello?
Yes, sir.
Yeah. Okay. So this is a transdermal drug delivery system or a transdermal patch. That was a patch which I showed you earlier. Okay. So the drug has to get released from the patch, then it has to get dissolved in the skin secretion. And as usual, I keep telling you, the dissolved form of the drug is absorbed into what you can call it as systemic circulation. That is what you mean by transdermal drug delivery. As you can see here, okay, the drug gets absorbed, enters into systemic circulation, and then reaches the target site. Okay, this is a major difference between a topical versus a transdermal drug delivery system. Is it clear? Are you clear, all of you? I need response. Is it clear? Are you clear or no? Hello?
Yes, sir.
Yes,
That is
sir.
what I need a response. But one of you should respond. Otherwise, I'll not get convinced. Okay, there is no need for all these exercises to be done. Okay, in these conditions. That's what I believe in. Okay, so that is the difference between. Did you understand the difference between topical and transdermal? If you have understood, you can tell yes. Otherwise, please tell me no. I can repeat it again. Okay, please don't have any apprehension. Is it clear? All of you are clear? Can I move forward? Hello?
Yes, sir.
Hello? Yeah, that's what I want the response, ma. Okay. So what are the advantages of topical? Sorry, advantages of transdermal drug delivery. So it is we are able to see what it is able to supply a constant rate of delivery similar to what I dealt with the sustained release dosage forms. I think I would have told you. So this can deliver the drug at a very constant rate. So reasonably constant rate of delivery can be achieved for prolonged periods of time. That's the first advantage. Then many a times, for example, we're able to meet the therapeutic levels for nearly 1 to 7 days. That's one more advantage what you're having. Okay, it is meant for long term. And third is, excuse me, it is the big advantage of transdermal drug delivery system is that all of you know what is first pass metabolism? Yes or no? Yes? I want the response, please. Yes? Yes or no? Nobody knows?
Yes, sir. Yes, sir.
What is first pass metabolism? Please tell na. Whatever you know, you tell. I'm not a person who points out and tell you don't know even this. Okay? I am also ignorant of several things, pa. Okay? Not that everybody should know everything. That is what I believe. Okay? What is first pass metabolism? What you understand, because that's a big advantage of transdermal drug delivery. What's first pass metabolism? Yes? You people would have studied pharmacology. Correct. Okay. Yes. Then, okay, the drug which undergoes metabolism in the liver. So please listen and let me know if you have clearly understood or not. So what will happen is, if at all any drug is delivered orally or given as a oral tablet or capsules, okay, many drugs, what will happen is, for example, yes, they undergo extensive first pass metabolism. Okay, so what is known as enterohepatic recycling. I think I told you this. Okay, so they get absorbed through the stomach, enter the liver, they undergo metabolism by the hepatic enzyme, and a fraction is secreted to the bile and enters back into the small intestine. By this process, what will happen is a fraction of the drug is not orally bioavailable. Did you get my point? Are you able to understand? Yes or no?
Yes, sir.
Hello? So, what will happen is, did you understand the whole concept? Concept is very important here, ma. Okay. So, whenever anything is taken orally, what will happen is it will get absorbed. No doubt about that. Many drugs, for example, especially BCS class 2. Yes, I'm talking about. Okay. So, once they are absorbed, first thing is many of the drugs will enter the liver because they are metabolized by the hepatic enzymes that are present in the liver. And again, the rest of the drug after metabolism, what will happen is they come back to the intestine. This is what is known as through the bile duct. Again, okay, all this is pharmacology. Is it clear? And during this course, during enterohepatic recycling, what will happen is many a time majority of the drug also may be lost. For example, you take diclofenac sodium. Okay, the most common drug which I keep on exemplifying, 50% of diclofenac sodium is lost because of fast metabolism mode. Okay, are you able to understand? Yes or no? Yes. Please unmute
Yes, sir.
yourself.
Yes, sir.
Did you understand the concept? Okay, this is a wonderful concept for anybody to understand. Okay, because you'll not understand the implication of what you can call it as novel drug delivery system if you are not able to understand what is known as first pass metabolism. Is it clear? Did you understand what is first pass metabolism?
Yes, sir. Yes, sir.
Yes. So during this process, so how you can avoid it? For example, that is a question like, okay, so transdermal, if you are giving the drug by the transdermal route, you can overcome the first pass metabolism. That's the biggest advantage what anybody can see today. Okay, for example, you have a dose which is 50 mg of diclofenac, you can just give 25 mg and elicit the same therapeutic response. That is the advantage. Are you able to understand? Is it clear what I meant? Yes? Hello?
Yes, sir.
Sir.
Hello? So that is advantage. Please keep talking. Okay. Otherwise, this is basically meant for meeting, ma. Okay. That is why you can call it. It is not a class. I always tell. Okay. It's a 1:1 meeting. Not that everybody should know everything also. Okay. Please be very clear. Okay. Otherwise, it will be very difficult for me to percolate the info on the online mode. Is it clear? Offline, at least when you come right here, I can always see whether you have understood. Looking at your face, I'll be able to see whether you have understood or not and try to clear the concepts. These are all basic concepts which many of them will not even understand even when they come to IMPA. I'm telling you. Is it clear? Yes, you're really fortunate to have teachers in Keli, I'm telling you, who really make the sincere attempt to make you understand, make use of it. Is it clear? So that is what you mean by first pass metabolism. So that is the limitations of the drug which undergo first pass metabolism also. Okay, sizable fraction of what you can call it as new chemical entities will undergo first pass metabolism. Diclofenac sodium may be one of them. Is it clear? There are several other molecules, okay, which undergo first pass metabolism. Is it clear now? Yes. So, by first pass metabolism, what is the limitation of first pass metabolism? Tell me now. Yes. What is the drawback? If you tell, I'm not. If you're not able to tell or speak, I'm not proceeding. It indicates that it implies that you're not understood. Yeah, tell quick. What is the limitation? You heard me now speaking. Okay. What is the limitation?
So drug
Yeah,
should be
please.
analyzed
Ask.
to get the metabolism.
Huh? Hello?
Drug should
Yes,
be in the
Asif.
form of an
Hussein. Tell me. Yeah, what is the limitation? Now I told you about first pass metabolism. What is the limitation or drawback or disadvantage of first pass metabolism? Any other more refined form? As if, yeah, others can give a try. Hello?
100% dose cannot reach.
Hello? Yeah, excellent, pa. Okay, so you administer 50 mg, you'll be getting only, sorry, you administer 100 mg, for example, you may get only 50 mg, pa. Excellent. Who is this? Could not see the name. Yes?
Low bioavailability, sir.
Hello?
Hello, sir. Low bioavailability.
Yeah, Shashank, excellent, excellent. Make a small correction there. Low oral bioavailability. Understood? Be very specific.
Okay,
Are you able to
sir.
understand? Yes?
Okay.
Ah,
Okay, sir.
so the oral bioavailability of all the drugs which undergo first pass metabolism will be reduced drastically. Is it clear? So there are methods by which you can avoid this. Okay, but how? One of the modality what I'm going to discuss today. Is it clear? This is yes. Are you able to understand? Is it clear? Am I audible
Yes, sir.
or not?
Yes, sir.
Are you able to hear me? Yes? My voice is
Yes.
low?
No, sir.
Aditi?
We can hear you properly.
No problem? Ah, okay. So that is the limitation of first pass metabolism. I don't know, many of the teachers
No,
wouldn't have
sir.
made it
You're
a
audible.
point to touch what is the limitation of first pass. Yeah,
No, sir.
thanks, ma. Okay. So transdermal route is one of the modality by which you can reduce the first pass metabolism. Not reduce, overcome the first pass metabolism. So if you are administering any such drug by transdermal route, if you are applying, for example, 10 mg, all the 10 mg goes into systemic circulation. Are you able to understand? So almost 100%, I mean to say. Is it clear now? Is it clear? Is it advantage or disadvantage? Hello? Hello? Is it advantage or disadvantage? Tell me.
Advantage, sir.
Yeah, Divya, excellent, ma. So it's a big advantage. Okay, you are able to achieve 100%. For example, for example, diclofenac sodium itself, only 50% bioavailability, though it's given by oral route. Okay, oral route is the most comfortable route which has been discovered till date. Agree upon that. You can just swallow a tablet and forget. Okay, yes, but the limitation is that many of the things which you swallow may be available only to an extent of 50% or even lesser some cases. So transdermal route is the one which will be able to overcome the first pass metabolism, and also what you can call it as many of the associated gastric breakdown or gastric side effects. Okay, so this is the next advantage what you can see. Thereby what you're doing is you are trying to allow dose reduction. As somebody pointed out, Shashank I think pointed out rightly. Okay, you can reduce the dose, sir. Excellent. This is what is the point what I wanted to tell you. It allows dose reduction, and thereby it also minimizes side effect. Because why? Because you're administering a lesser dose to a patient. Instead of giving 100 mg, you can just give 50 mg. Is it clear? And minimizes the gastrointestinal side effect. For example, diclofenac itself, you take one of the first batch that has come to Indian market is diclofenac. The reason for that is oral, for example, if at all diclofenac is taken, many of the people, sizable population of the people, okay, see severe side effects, something like to an extent of even gastric ulceration. Okay, so If at all the same drug is given by transdermal mode, it minimizes the gastric side effects. Most importantly, it is non-invasive. What is non-invasive? Tell, being final year, you should tell. This is the first time, I think, or second time maybe I am encountering you people. Maybe I would have handled few chapters in biopharmaceutics and pharmacokinetics. But after that, this is the only time where I am encountering you. What is non-invasive?
No breakage of skin or any mucous membrane.
Like minimum
Non-invasive.
instruments.
Anything simple? Very close, Aditi, but again.
Non-invasive, then no instruments.
No injections, ma. It's pain-free. That's it, as simple as that. Please remember that. Okay. For example, when somebody is going to take prick, whatever it is, it may be, you call it as an invasive mode. Somebody is on an injection, you call it as an invasive mode. So this is non-invasive. That is, it is pain-free. Shall I move to the next slide now?
Yes, sir.
Do you understand?
Yes, sir.
Good. Yeah, ma. Thanks. And one more is, it enables self-administration. Okay, self-administration is very easy. You don't require a doctor. For example, injection, you require a doctor or a nurse. Here it is, you can administer yourself and even terminate the therapy. How do you terminate? Simple question. Antiplast is there. How do you terminate? The mobility of the drug. Drug goes, for example. Okay, how do you terminate?
Removing.
Yes, Nihal. Just pull out the patch. Okay, pull out the patch. Okay, so it can be administered on your own. It can be terminated on your own. But there are certain limitations also, as you can see now. Okay, so the first one is poor permeation. All the drugs may not pass through the skin. That's the biggest limitation what transdermal drug delivery system may have. Okay, you have to look for only those drugs which pass through the skin. I'll tell you how we can choose. And next is, it is suitable only for potent drugs. What do you mean by potent? I'm asking you two simple questions. Is it too simple? That's why your people are facing problem in answering? Or it's too complicated? Yeah, tell me. Is it simple or complicated? Too simple to answer or too complicated to answer? What are potent? Nobody has answer. Not even one knows.
At low
Yes.
concentration, it will show maximum effect.
Yeah, correct. So, what will be the dose? Dose. What can be the dose?
Within 1 mg.
Potent drugs.
Lower dose, lower dose.
So low dose. It's exactly as simple as that. That is what answer I wanted from you. Okay. These are the drugs which have got very low dose because they are called as potent. Okay. So transdermal drug delivery system is suitable for only low dose drug. Okay. Yes. The next is drugs having short half-life and high blood levels, which display high blood levels, are mostly unsuitable. Okay. So drugs having short half-lives and those requiring very high blood levels. Okay, you'll not be able to generate huge blood levels with these mode of treatment. So such drugs are unsuitable. Okay. And many times in Indian scenario, what people feel is that it is uncomfortable to wear. It is something like somebody putting on a watch, for example. You always feel that nowadays most of you don't put on the watch. Earlier days, I think, yes, most of you would have seen that most of us will be wearing a watch. That's what you see. Okay, you can see the earlier movies also. Yes. So what was there? Again, it depends on the passion. Okay. So something like that. It is something like which is present on your body. That's what you'll always feel. Okay. You just see a person with a bandage, things like that, something like that. So many of them feel it's uncomfortable to wear. Okay. It's a feeling again. Okay. And next is, many times what will happen is these systems have the tendency to cause dermatitis. Okay. And skin irritation. Okay. So because routinely when you start applying, what will happen is there are chances that it may cause skin dermatitis as well as skin irritation. Next is, again, the barrier property. Barrier is to what extent the skin can oppose the permeation of the drug. That is what is known as barrier property of the skin. That changes from one person to another. Okay, it is always there. Yes, and from site to site. That is, some regions of the body, for example, yes, where you can see the drug is readily permeable. Some regions you can see that the drug may not be readily permeable. Okay, so it varies. A lot of variation is there depending on the site of application, and from person to person, site to site. Okay, there's a lot of variation. According to that, what will happen is the amount that gets delivered or the amount that reaches the systemic circulation also keeps varying. Okay, so it's very difficult for you to generate what you can call it as a therapeutic response that easily. Are you able to understand? Yes, that's very clear. Is it clear? Are you able to clear? Yes. Yes or no?
Yes, sir. Yes, sir.
The last one is, many times, I don't know whether you have seen, it will cause perspiration. Perspiration is extensive sweating. Okay. And what you can call it as showering prevents the adhering. Something like your handiplasma. There are newer kind of handiplasts which have come out. Okay. Can you remember and tell me what are the handiplasts that have come out? Any innovation in handiplast? This is an interesting question for you people. Okay. Yes. What is perspiration? I told you. Sweating, profuse sweating can be called as perspiration. Okay. Yes. And showering. Is there any way by which you can prevent this? Taking the example of handiplast. The newer one which has come into the market. Yes. Do you understand my question? Tell yes or no. How do you prevent the last one? No, you didn't understand my question. The limitation with any transdermal patch or your simple handiplast is that this is the last limitation. Okay, profuse sweating and showering, that is having a bath, prevents the patch from adhering to the skin. How do you overcome this? One product is already there in the market. Anybody can recall and tell? Because I'm trying to connect this with the marketed products. Try to analyze. Okay, tomorrow one of you may come out with a wonderful product which is not there in the market. So I'm trying to correlate. Yeah. Please. Anybody? Nobody has any idea? How do you overcome this? How do you prevent this?
Can you repeat it once, sir?
No answer? No. See there, what is the question? Did you understand the question there? Perspiration is sweating, okay, and having a bath prevents the patch from adhering to the skin. Okay, that is a limitation, what I can call it as limitation, because transdermal patch should be in constant, okay, touch with the skin, both at the microscopic and a macroscopic level. Okay, then only drug delivery will happen. Is it clear? But many times what will happen is it will not come in direct contact with the skin. Okay, because of this reason. For example, somebody may use the patch because of profuse sweating. What will happen is the patch may come out. Second thing is, yes, somebody will put on the patch, something like a handy plus they say, and have a bath. Then what will happen is the patch comes out, something like a handy plus. Now what they have done now? Yes, one more product has come out with, so that it remains. Have you encountered such a product? Right. You're telling to tell
We'll
something.
cover one more answer upon that.
Nihal, not clear. Not able to hear clearly.
I mean, we'll cover something upon that, sir.
Did I tell or you're trying to tell? Nihal.
No, I'm trying, sir.
Yeah, try. Tell na. How do you overcome this? Simple solution, pa. Don't think of high. I always tell. Pharmacy is not a rocket science. Okay. Now, for example, with the advent of this COVID also, there are very simple solutions which have made big name. Always keep telling you. Okay. Yes. So many of the pharmacists, for example, simple idea really works out. For example, mask is a wonderful idea. Okay, that is a wonderful shield. What people tell now. Okay, till the advent of what you can call it as vaccine. Okay, it's a simple solution, very simple solution, but people have to follow something like this. Do you find any solution for this? The last problem what anybody is facing? No answers. So much of ideas I give. Did
We
you
have to rub it.
understand the question what I'm asking? Huh?
If water
Yes,
is there, we
Nihal?
have to rub it.
No, I don't know whether you have heard of Band-Aid washproof, pa. Have you heard? Have you heard or not? Yes,
Yes, sir.
Nihal? Then how many of you have heard? How many of you have used? You have used also, na? Have you used?
Yes, sir.
Then that is a wonderful solution for this. Okay, the last one. Okay, it is going to washproof is what? Even if you have, that means that even after having a bath, the patch may not come out. As simple as that. Did you understand till now? Yes? Hello?
Sir.
Hello? Hello?
Yes, sir.
Okay. So those are the limitations of the transdermal patches, including the last one which I told you, the cost factor. Now I think in the next class probably I'll be capturing what you can call it as a structure of the skin. Okay, this is a structure of the skin which you have already studied. Okay, now I'll quickly go through. Okay, so this is the structure of the skin which you would have already come across. Okay, and for example, as you can see, basically it comprises of 3 layers. Okay, one is epidermis, the other is dermis, the third is subcutaneous. Okay, so it's in the dermal region. As you can see, the blood vessels are flowing as well as the veins are flowing. That's what will happen. So what will happen is the patch which is applied on the surface of the intact skin has to pass through epidermis, enter the dermis, and reach these blood vessels, what you can see. That is, and then get into systemic circulation through the artery. Okay, because usually what will happen is, many times, most of the drugs are meant for systemic administration, not for topical administration. Is it clear? Are you able to understand? Yes? So, when it comes to what are the different layers again? Epidermis is found to be the major barrier for permeation of most of the therapeutic agents, whereas the permeation of the drug to the dermis is not a rate limiting step, okay, or a slow process. So what about epidermis? Epidermis in turn comprises of these layers, that is stratum corneum, granular layer, spinous layer, and the basal layer. These are the 4 layers. Among this, stratum corneum is the outermost layer of the skin, which basically contains of dead cells. That cells are not live. Okay, whatever cells you are able to see, the surface of the skin. Okay, for most of us, they are dead cells. The outermost layer, that is the stratum corneum. That is the biggest barrier for permeation of most of the therapeutic agents. So once the drug passes stratum corneum, it's very easy for the drug to enter into systemic circulation. So n number of methods have been tried, okay, yes, to overcome the barrier property of stratum corneum. That may include physical methods as well as chemical methods. Okay, so that as you go deeper and deeper into transdermal drug delivery, okay, you can study that. Otherwise, it may not be required at this stage at B.Pharm level. Suppose somebody is very interested to undertake this mode, okay, you are most welcome to do M.Pharm at our college. That's what I can tell you. Yes, because there are a number of skin clinics in Bangalore. I don't know how many of you have seen that. Okay, for example, yes, people who stay nearby will come to know there's something called Cutis, which is there in Vijayanagar. There are a number of skin clinics, okay, because beautification nowadays has become a very essential component, okay, especially with girls. Yes, so number of skin clinics have come up. So anybody want to come up with their own product, okay, it's a wonderful time for you people. Yes, either into drug delivery or beautification, anything, okay, they need to work on the skin. Okay, so you can really come out with wonderful dosage form which can be meant for topical application or transdermal application, both it is. Okay, so the big scope is there, especially now onwards for pharma, as you know, as people are hearing now. Okay, it's a wonderful age for pharma. So see that most of you gain some higher education also. Okay, if somebody wants to get into R&D, somebody wants to come out with their own product, I don't think B.Pharm is sufficient. You need to do something called M.Pharm or PhD, which is there an ongoing program at our college. Okay, we encourage everybody, each and everybody, every student, as long as parents are able to support you. Okay, yes, I advise you people to take up the higher studies. Okay, it may be M.Pharm as well as PhD. That's the only thing I can tell you. Okay, in some other deeper domains, something like this. Okay, many of them are working on this particular domain in our college under me. PhD I'm talking about, and there may be a couple of M.Pharms. Okay, but skin work is relatively what you can call as tougher. Okay, because I make them work on the real skin so that they see the real time effect. Okay, nothing like you are able to use a dialysis membrane, see the permeation, nothing like that. You have to take some real skin and do the permeation and see whether the drug exactly permeates, yes, through the skin. That is the motto. So you have to, that is the depth of what science, to what extent we have gone. Yes, so you are most welcome to do the M.Pharm in this domain or PhD also in this domain. Yes, Prajila madam, for example, she left her job and came here to do PhD. Even Dhritish has come from all over Kolkata to here to work under me. Okay, I need not go on listing like this. Okay, Mansa was there with earlier with us. She has finished her PhD and she has joined Milan. Okay, so you'll get excellent positions, no doubt about that. Okay, so as long as your parents are able to support, okay, it's always advisable that you are doing your masters. Okay, that much of assurance people should have. Is it clear? Because B.Pharm gives you only superficial knowledge. Okay, and most of the companies which come for hiring will come for hiring only for production quality control, okay, or marketing. These are the main domains, okay, on which they are hiring B farms. Is it clear? Yes, these are job prospects. If you want me to talk, I can go on talking. This again, I will not a part of syllabus. Okay, so please understand your responsibilities, okay, and act accordingly. Is it clear? Are you able to understand? Yes. Hello. All of you are there? Hello.
Yes, sir.
Yes, sir.
Yeah, Pranay. Yeah. Yeah, Hiral. Yeah, pa. Just act accordingly. So this would be the structure of the skin. So epidermis is one of the barrier, among which stratum corneum is the biggest barrier for permeation of most of the therapeutic entities. So pathways of permeation I'll be discussing in the next class. Is it clear? Okay. Hello. Hello. Hello.
Yes, sir.
Okay, ma. Thanks. The rest I'll continue in the next class. See you all in the next class. Take care of yourself. Okay. Yes. Okay.
Thank you, sir.
Thanks. Thanks. Bye.
Thank you.